Hi there. Thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We continue our conversations around the COVID-19 pandemic as it continues to rage across the globe. If you have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. As usual, I start off with wearing my mask to completely cover my nose and mouth, because that's the correct way to wear your mask. It is not correct to wear it just to cover the nose or just to cover the mouth or to wear it under the chin or on the forehead. I will take it off for the remainder of this conversation by using the straps behind my ears. Now, we continue to speak about COVID-19. It continues to be an active issue in Guyana, as it has been for the past year or so. And it continues to be a major determinant of our daily activities, the way we interact with our friends, our families, the way we travel, the way we conduct business, the way we go into buildings. School has been affected. Children are home from school. The financial engines of the society has been affected, not just in Guyana, but across the world. As it stands now, and we are in the second week of March 2021, in Guyana, we would have had 8,814 cases that are positively recorded as COVID. Of those, there was an unfortunate number of deaths recorded at 203. And those persons who would have recovered, thankfully, they are 8,171. It means, therefore, if we were to calculate our case fatality rate, that's the number of deaths over the number of positive cases, we have a 2.3% death rate from COVID-19 infection positives. And our recovery rate is 92 point something percent. So that's an encouraging recovery rate. And every death is regrettable, of course. But when you look across the world, Guyana is not doing worse than anywhere else. In fact, the WHO has firmly recognized that across the world, across continents, despite advances in treatment, despite all other public health measures, the death rate or the case fatality rate for COVID-19 is between 2 to 3%. So we're very grateful that we in Guyana are closer to the lower limit of that range. If we look at our total COVID-19 cases in Guyana since we started keeping track and recording, we see that we had a steep rise that started in late July and early August, and it continues. We touched 2,000 cases sometime in maybe early September. We touched 5,000 cases in November, and we're on our way to about 10,000 cases now that we are in March, and we'll probably get there sometime in April. Now, we have had an improved infrastructure in place now to do testing. We are testing a lot more people, so we are therefore able to find a lot more positive cases. So whereas we started out last year, March, April, doing 10, 15 tests per day, it is quite common now and quite normal and routine for us to do 200, 300, sometimes 400 tests per day. We have several authorized and approved centers that are doing the testing for patients, and this is PCR testing, that is the confirmation of positive COVID cases. And so we're lucky that we have a number of centers that are improving their service provided to the public. And so therefore we're testing larger number of patients, and we're therefore going to find a greater number of positive cases. If we look at the daily new cases that we are seeing, sometime, again, it coincides with more testing. Sometime in September or late August, we started seeing an average of 25 positive cases per day. And it really hasn't gotten to less than 25 cases per day until we got into 2021, late December 2020, early January 2021. That's when we started seeing a little drop in the number of daily cases testing positive for COVID. And then there was, of course, another rise in the number of cases in mid to late January, and in February now it is dropping again. Thankfully, we hope that that trend continues. And of course, part of this is due, that rise in January, February would have been due to social activities that occurred over the Christmas holidays. And as much as you tell people to wear your mask, socially distance yourself, it is difficult, and oftentimes people, just do what they're accustomed to doing, which is to go and visit their friends and families, have small house parties, or, get-togethers where they socialize and celebrate various events. And so we're about to see, or we saw that rise in cases. If we're looking at the graph again, this graph is going up in March, and I believe that some of that may be attributed to some of the social activities that surrounded our Mashramani celebration. Even though there was no official celebration of Mashramani, people still got together in small groups, and sometimes larger than recommended groups, and who knows what the precautions were during that time. So as a consequence of that kind of activity, we will see increased number of cases within the next week or two, and hopefully it will not be as bad as before, and we continue to see a decrease in the number of admitted patients to hospital and persons dying. Because as you know, we're all excited that recently we would have had the introduction of vaccinations program in Guyana, and we're very grateful that many persons would have stepped forward to take the vaccine. And we started out with healthcare workers, and now we have moved on to the group of 60 years and older. And as we get more and more to the vaccination program, we'll drop that age group to 50. We will add persons with comorbid conditions as diabetes, hypertension, kidney disease, etc., so that we capture a greater percentage of our population on our way to establishing herd immunity. If we look at the number of active cases in the country, again we see it started going up in August, where we had about 250 cases. And mind you, this is when we actually started doing much more testing. So we did start to find those positives. We peaked sometime in late September, early October, where we had over 1,000 active cases in the society. And as we got closer to the end of the year, that number started to fall, and it reached a bottom, about 200 active cases, sometime in early January in 2021. And again, after the Christmas activities, we saw that spike again in number of active cases in the society. In mid to late January and early February, it started coming down again. If you examine the graph closely towards the end of February and early March, you will see that it's starting to go up. And like I mentioned before, it is my belief that that is due to the social activities that surrounded the Mashramani celebrations, whether official or unofficial. The daily new deaths in Guyana, thankfully, we have been very, very lucky in this regard. And we often believe God is Guyanese, and there is no reason to believe otherwise at this point. If we look at the number of cases that has been unfortunately succumbed to this illness, we see most days that we had deaths, it was either 1 or 2 deaths. And there was a rare period in September, October, where we had up to 3 sometimes deaths per day. And we were lucky then, and then that fell again to 2 deaths per day. And when we have deaths now, it's usually 1, maybe 2 deaths per day. I can tell you, having looked at the data across the region, there are some places right in our CARICOM family that are experiencing tremendous loss on a daily basis. Numbers of positive cases are in the hundreds. In fact, as of 2 days ago, one of our sister CARICOM country recorded over 800 positive cases and averaging 7 to 10 deaths per day. We wish them well, and we continue to offer assistance in any way we can to our fellow CARICOM brothers and sisters, because we ourselves have benefited from the generosity of the people of Barbados when they donated the first set of vaccines to Guyana. And so we have to stand together in this pandemic. We have to help each other. Now, in the Liliendal facility, where we house all our COVID-19 positive patients that require hospitalization, at least those that are sick enough and referred to Region 4 or the Georgetown Public Hospital, as of the 2nd week of March 2021, we have a total of 8 ICU adults. That's 8 adults who are in the ICU, that's the intensive care unit. 2 of those persons are intubated. That means they're on a ventilator and receiving supplemental oxygen, etc., and they're receiving a higher level of care. 3 persons are on what we call CPAP, or continuous positive airway pressure. That's a different kind of machine that is hooked up around their face to force oxygen into their lungs. 1 person is on the transition ward, and 28 patients are on the general ward. That means they're sick enough to be in hospital, but not sick enough to be in the ICU. There's a lot of persons who are COVID positive, but are not sick enough to be in hospital. Of those 28 persons who are on the open ward or the non-ICU ward at the Liliendal facility, 4 of them are actually maternity patients. And these are persons who are pregnant and are expected to deliver, and we wish them well and wish them to have normal, successful deliveries. So this would have examined a significant amount of our statistics that we have. And just so we look at a little bit of detail what we talked about before, what is CPAP? CPAP, continuous positive airway pressure, is delivered by a mask that is strapped onto a person's face. It is covering both the nose and the mouth, and oftentimes the mask has to extend to below the chin. That mask is hooked up by a tube to a machine that generates oxygen that can be pumped into the lungs at an increased pressure to keep it open. It is a potential life-saving and life-changing option for treatment of sleep apnea, but we use this in the treatment of COVID-19 to provide proper oxygenation to these patients, because we know that oxygen requirement and oxygen utilization in these patients is much more affected than in the normal population. So I hope we would have spent some time to to explain something about our local statistics, our local condition as it relates to COVID-19. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you once again for joining me.